Anybody have any questions? Okay, so let's see if we can answer these things on this here in terms of anatomy. So what's a motion segment or vertebral motor unit? Ready? Is it the bones between the vertebrae themselves, or is it the area between where they move? Okay, so how many parts to the vertebral motor unit do we have? Wasn't there two? Right? Anterior and posterior. So what makes up the anterior motor unit? Well, what part is the disc? Is that okay? So you have the disc, and then what's on top and bottom of the disc? Vertebra. What part of the vertebra, though, to be specific?
Body.
Body of the vertebra. Okay? So the anterior motor unit, you have the vertebral body, the disc, and then what ligaments go on either side of the vertebral body? What do you call the front of the body as opposed to the back?
Anterior.
Anterior. Okay? If something goes all the way up and down, what's the name for that? Longitudinal. Right? So anterior longitudinal ligament. Then what's going to be on the back side of the vertebral body? Posterior longitudinal. Okay. So that's the anterior motor unit. So then what's left? Right? And so then what parts of the vertebral body of the vertebra are left? If you're coming right off of the body, what's the first part here? You have the lamina and the facet joints. And then when the two lamina come together, what does that form on the back part?
Spinous process.
Yeah. All right, and then is there a ligament that goes between the spinous process? Or what would you call that? So it's interspinous ligament, and then you have the transverse process on the side. So what goes between those? If it goes between the SPs, you call it interspinous. What are you going to call it between the transverse process? Intertransverse, right. And then you have the facet joints. What kind of ligament surrounds the facet joint? The joint capsule, right? Facet joint capsule. And then what did you say about that? Is that pain sensitive or not? Yes. Yeah. Okay. And what are the shape of the facet joints in the cervical spine, or what kind of plane are they in? They're about 45 degrees, depending on the part of the spine, but they force the upper part of the facet joint faces superior and posterior, and then the inferior part faces anterior and inferior. So they articulate like this. Right? So then when the cervical spine moves, it's a combination of rotation and lateral flexion. So what's the function of the disc? It's shock absorbers, right? And then also helps to maintain the shape of the spine. Right? What are the different parts of the disc? Annulus fibrosus, they both end in the US. Annulus fibrosus and nucleus pulposus. So what happens to discs when they're injured? What kind of disc injuries or problems do you have? Disc herniations. So how does the herniation happen? You have the outer rings of the annulus fibrosus. They can either be weakened and stretched, and you can have a bulging of the disc, or they can have a tear or a fissure, and then you have a herniation. So herniation, what part from the inside moves out? The nucleus pulposus, right? It's going to bulge out through the annulus fibrosus. You can have a bulge or you can have a herniation.
Is there more medical term for a bulge?
We'll get into it a little bit more when we talk about the lumbar disc. But basically you can have a prolapse, which is like kind of a compression of the disc where the annulus fibrosus is intact. Then you can have a herniation where you have actual stretching or tearing of the annulus fibrosus. Then you can have all the way up to sequestration, where there's a tear in the annulus, the nucleus pulposus has moved all the way out beyond the edge of it, and pieces have broken off. All right, so then now we're going to get into the conditions. And what we'll do is, this is going to go over into next week as well. So wherever we cover up to this point, then you want to know those conditions for the quiz. But obviously, all this front part we've gone over, we've covered that. Right? So then when we get into the conditions, we'll go as far as we can, as time permitting. And again, we're going to be talking about cervical and thoracic outlet together. And we'll be doing the examination of the two together.
So we are responsible for conditions next week?
As far as we get to in today's class, yeah. All right, so then remember before, we're going to always start out with dividing into two different things. We're going to talk about typically acute traumatic conditions first. And then what types of tissues do we say are normally affected by traumatic conditions? Inert tissue. So you're going to have bones, you're going to have fractures, dislocations, sprains, things of that nature. And in this case, acute injuries, you can also have neurologic injuries, because obviously you've heard about, cervical fractures, people have spinal cord injuries, paraplegia, hemiplegia, things like that. So the first one we'll talk about is different types of cervical fractures. You can have something where there's going to be like somebody dives into a swimming pool and hits the bottom. You can have a compression type of mechanism of injury where you're compressing the spine like that. And what you can have is it can be a burst fracture, where you have the atlas as a ring like this, and basically it just bursts apart. So, I mean, this isn't the atlas here, but basically it has fractures around the ring. So the ring has lost its integrity. It separates out. You can have other things which are, like there's something called a clay shoveler's fracture, where somebody's going like this and they go back like that. Right? So if somebody's bending backwards like that, what's going to happen to these spinous processes? Are they going to come together or be separated?
Yeah.
They're going to come together, right? So if one hits the other, you can fracture a tip of the spinous process. Okay? If you had your choice, which fracture would you rather have? A burst fracture or a spinous fracture? Spinous fracture, yeah. Okay, because you have fractures that are going to affect the spinal cord and others that aren't. Okay, so obviously if you affect the spinal cord, you're going to be talking about paralysis, spinal cord injuries. Otherwise, if it's just a piece of bone, it's just like another fracture. It's not going to affect the spinal cord.
Could you have a burst fracture without affecting the spinal cord?
Yeah, but your neck's going to be unstable. I mean, you're going to be talking about halo braces, and it just depends on the injury. If it just all of a sudden bursts, but usually it's not going to be a good situation. It depends on if it's just enough to break it and there's not a lot of movement, then maybe there's not going to be damage to the spinal cord, but at least you're going to have spinal shock probably. I mean, obviously I don't deal with those kinds of conditions as much. None of us are really going to deal with it too much, unless post-acute, post-surgical, things like that. You maybe have a patient that said, well, yeah, I broke my neck, I had to have a brace, but now it's pretty much recovered, and you may be doing pain management or something like that.